Hello, NCLEX students, and welcome back to the 30 Days NCLEX Challenge, where we tackle one full practice test every single day for 30 days. Today is day 8, and by the end of this challenge, you'll have solved over 2,000 high-yield NCLEX questions, giving you the knowledge, confidence, and test-taking edge to pass the NCLEX on your very first attempt. And if you're looking for a complete NCLEX review crash course, we've got something special for you. Our online program is now available at 70% off, but only for a limited time. The link is right there in the description. Now, let's dive into today's practice test and take one step closer to becoming a licensed nurse. Let's begin. Let us begin with our first high-yield NCLEX question. 1. The nurse recognizes which prescribed medication places the client at the highest risk for developing Stevens-Johnson syndrome. Here are the options. Option A, citalopram. Option B, methylphenidate. Option C, lamotrigine. Or Option D, verapamil. The correct answer is Option C, lamotrigine. Now, let us explore the rationale behind this choice. Lamotrigine is an anticonvulsant that also serves as a mood stabilizer, especially for clients managing bipolar disorder. Unfortunately, one of the most dangerous and potentially fatal side effects of lamotrigine is Stevens-Johnson syndrome, a rare hypersensitivity reaction. This condition begins with vague symptoms such as fever, sore throat, and malaise, but can rapidly progress to painful, blistering rashes that affect the mucous membranes. Because the reaction is so severe, clients are always instructed to report any rash or flu-like symptoms immediately, especially during the first few weeks of starting therapy, or if the dosage is increased too quickly. Moving on to our next scenario, here is question 2. A nurse is preparing to discharge a client when the client expresses a desire to become an organ donor. Which nursing action best supports and facilitates the organ donation process? Let us look at the options. Option A, providing the client with information about how to register as an organ donor. Option B, advising the client to sign an organ donor card and carry it with them at all times. Option C, scheduling the client for immediate organ donation surgery upon expressing interest. Or Option D, assisting the client in completing advance directives, specifying their wish for organ donation. The correct answer is Option A, providing the client with information about how to register as an organ donor. Now, here's the rationale. The nurse's priority in this situation is to empower the client with clear and accurate information. Educating the client about how to officially register with a national or regional donor registry ensures their intent is legally documented and accessible to healthcare professionals and organ procurement organizations when needed. Nurses serve as facilitators of informed decision-making, especially regarding organ donation. Let us continue with question 3, which highlights the importance of medication reconciliation in immunocompromised clients. The nurse is evaluating laboratory findings for a client living with human immunodeficiency virus, or HIV, and notices a rising viral load despite continued antiretroviral therapy. Which of the following current medications should the nurse immediately clarify with the primary healthcare provider? Your options are Option A, acetaminophen, Option B, echinacea, Option C, cetirizine, or Option D, calcium carbonate. The correct answer is Option B, echinacea. Here is why. Echinacea is an herbal supplement commonly marketed to boost immune function, but for clients with HIV, it can be harmful. Echinacea may induce liver enzymes, especially cytochrome P450-3A4, which metabolizes many antiretrovirals. This interaction can reduce drug levels in the bloodstream, decreasing their effectiveness and allowing viral replication to increase. Because strict medication adherence and absorption are critical to suppressing the virus, this supplement must be discussed with the healthcare provider immediately. Now, transitioning to a critical emergency care scenario, let us look at question 4. A client exposed to radioactive substances during a workplace accident is brought to the emergency department. The client's supervisor has already informed the hospital of the chemical agent involved. What is the nurse's immediate priority upon receiving the client? The answer choices are Option A, remove all of the client's clothing and perform skin decontamination. Option B, ask the client for details about the incident. Option C, begin decontaminating the client's assigned hospital room. Or Option D, save the client's clothing for radiological analysis. The correct answer is Option A, remove all of the client's clothing and perform skin decontamination. Here is the rationale. When handling a client exposed to radioactive material, the top priority is to stop further contamination and minimize absorption into the body. Removing the client's clothing can eliminate up to 90% of external radioactive particles, and immediate gentle cleansing with soap and warm water can significantly reduce the spread. This must be done before any medical treatment or diagnostic evaluation. Let us move forward with question 5, which focuses on clinical prioritization. The nurse is assigned to care for 4 clients during a busy shift. Which client should the nurse assess first? The options are: Option A, a client with a femur fracture, reporting pain level 4 out of 10. Option B, a client with chronic obstructive pulmonary disease, experiencing shortness of breath while ambulating. Option C, a client with a T6 spinal cord injury, reporting a pounding headache and excessive sweating. Option D, a client 1 day post-operative from an open cholecystectomy with green bile draining from the T-tube. The correct answer is Option C. This client is showing classic signs of autonomic dysreflexia, a life-threatening emergency seen in individuals with spinal cord injuries at or above the T6 level. Symptoms such as a pounding headache and sweating indicate a sudden rise in blood pressure, which can result in stroke or seizures. Immediate intervention is required, making this client the highest priority. Now transitioning to question 6, the nurse is assessing a client with a newly inserted chest tube and wants to evaluate for the presence of crepitus. Which assessment technique is most appropriate for detecting this complication? The answer choices are: Option A, pressing on the client's abdomen and assessing for pain on release. Option B, palpating around the chest tube insertion site for a crackling sensation under the skin. Option C, auscultating the client's abdomen in all 4 quadrants for bowel sounds. Option D, observing the client's chest for symmetrical expansion during respiration. The correct answer is Option B. Palpating around the insertion site for a crackling sensation helps identify subcutaneous emphysema, also known as crepitus. This can occur if air leaks into the tissue around the chest tube site and needs to be monitored closely, as it may indicate a malfunction in the drainage system. Next is question 7, which focuses on client education. The nurse is teaching a client with hypertension about the newly prescribed medication diltiazem. Which statement made by the nurse is most appropriate? The options are: Option A, you may develop a persistent cough while taking this medication. Option B, this drug might cause you to urinate more frequently. Option C, avoid drinking grapefruit juice while on this medication. Option D, be sure to eat more foods that are high in potassium. The correct answer is Option C. Clients taking diltiazem, a calcium channel blocker, should avoid grapefruit juice because it can inhibit liver enzymes and lead to dangerously high drug levels, increasing the risk of hypotension and bradycardia. This is an essential part of client education to ensure safe medication use. If this video is helping you understand NCLEX concepts better, just imagine what our complete Stand Coast NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX-style practice questions, detailed mock exams, ebook, 1-year ACES, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today, link is in description, and take the stress out of NCLEX prep. Finally, let us move to question 8, which deals with safe opioid administration. A client receiving fentanyl via a patient-controlled analgesia, PCA pump reports increased pain, and the nurse receives a new prescription to adjust the settings. What is the nurse's first action after reprogramming the device? The options are: Option A, verify the new PCA settings with a second nurse. Option B, educate the client about the potential side effects of fentanyl. Option C, reposition the client to promote non-pharmacologic comfort. Option D, reassess the client's pain level before administering the medication. The correct answer is Option A. Fentanyl is a high-alert medication, and any changes to PCA pump settings must be double-checked by 2 licensed nurses before activation. This verification step ensures the correct dosage is administered and helps prevent serious medication errors. Let us move on to the next important pharmacology scenario. Question 9. The nurse is caring for a client who has been prescribed a monoamine oxidase inhibitor, commonly known as an MAOI, for the treatment of depression. The nurse needs to educate the client on which parameter to monitor most closely during the course of this therapy. Here are the options. A. Blood pressure. B. Pulse. C. Capillary blood glucose. D. Daily weight. The correct answer is option A, blood pressure. Now let us understand why this is the right choice. Blood pressure monitoring is absolutely critical for clients taking monoamine oxidase inhibitors because of their significant risk of causing both orthostatic hypotension and hypertensive crises. A hypertensive crisis can occur if the client consumes foods high in tyramine, such as aged cheeses, cured meats, or fermented products, or combines MAOIs with contraindicated medications like pseudoephedrine or selective serotonin reuptake inhibitors. These dangerous interactions can lead to sudden spikes in blood pressure, severe headaches, and even stroke. Therefore, clients must be instructed to check their blood pressure regularly, especially when initiating therapy or making changes to their diet or medication regimen. Moving right along in our NCLEX journey, let us now explore Question 10, which focuses on pharmacologic education. The nurse is providing important instructions to a client who has just been prescribed Tamsulosin for benign prostatic hyperplasia, or BPH. The nurse needs to ensure the client understands which teaching point. Here are the options to consider. A. This medication may cause your urine to turn reddish-orange. B. You will begin to urinate more frequently after starting this medication. C. Change positions slowly while taking this medication to avoid dizziness. Or D. You should avoid calcium-rich foods while taking this medication. The correct answer is option C, change positions slowly while taking this medication to avoid dizziness. This is the right choice because Tamsulosin is an alpha-1 adrenergic antagonist that relaxes the smooth muscle of the bladder neck and prostate to improve urine flow. However, this same action can cause vasodilation, leading to orthostatic hypotension when changing positions too quickly. This increases the risk of falls and fainting, especially in older adults. Therefore, it is vital for the nurse to emphasize the importance of rising slowly from sitting or lying positions to maintain safety. Now let us shift our focus to a scenario involving medication safety with Question 11. The nurse is assessing a client who is taking both Digoxin and furosemide and needs to identify which finding would require immediate follow-up. Here are the options. A. Night sweats and a persistent headache. B. Vomiting and visual disturbances such as halos around lights. C. Fatigue and dry, flaky skin. Or D. Low blood pressure with dark-colored urine. The correct answer is option B, vomiting and visual disturbances such as halos around lights. This is because these symptoms are classic indicators of digoxin toxicity, a potentially life-threatening condition. Digoxin has a narrow therapeutic range, and when combined with furosemide, a loop diuretic that can cause hypokalemia, the risk of toxicity and dangerous arrhythmias increases dramatically. This finding calls for immediate lab evaluation and possibly adjusting the medication regimen to prevent further harm. Continuing on to Question 12, let us consider a nurse attending an in-service education session on caring for clients with peripheral arterial disease, or PAD. The nurse makes a statement that requires correction and follow-up. Which of these statements is concerning? The options are A. Clients with PAD should be encouraged to walk daily as part of their treatment. B. Smoking cessation is a critical component in managing peripheral arterial disease. C. Resting with legs in a dependent position may help improve lower extremity circulation. Or D. Clients should be discharged with devices that elevate their legs above heart level to enhance venous return. The correct answer is option D. Clients should be discharged with devices that elevate their legs above heart level to enhance venous return. This statement is incorrect because elevating the legs is helpful for venous insufficiency, not arterial insufficiency. In PAD, elevating the legs reduces arterial blood flow, worsening ischemia, and symptoms like pain and poor wound healing. Clients with PAD benefit more from keeping their legs dependent to improve perfusion. Let us now move ahead to a pediatric scenario with Question 13. The parents of a toddler report that their child is having trouble sleeping, is experiencing intense itching around the anus, and is frequently scratching. The nurse must determine the most likely condition. The options are A. Anal fissure, B. Enterobiasis, C. Giardiasis, or D. Celiac disease. The correct answer is option B. Enterobiasis. This condition, commonly known as pinworm infection, is the most frequent helminthic infection in young children. The hallmark is nocturnal perianal itching because the female worms migrate at night to lay eggs. The condition is highly contagious and spreads through fecal-oral contact, often via contaminated hands, bedding, or surfaces. Prompt treatment and hygiene education are key to preventing recurrence. Finally, let us turn to a surgical nursing topic with question 14. The nurse is caring for a client recovering from a recent hand arthroplasty. The nurse must identify which intervention to avoid in the care plan to prevent post-operative complications. The options include A. Encourage frequent finger and wrist exercises using full range of motion. B. Ensure personal items are placed within reach of the non-operative hand. C. Rest the operative arm on a pillow in an elevated position. Or D. Promote independence by encouraging use of the non-operative hand. The correct answer is option C. Rest the operative arm on a pillow in an elevated position. Although elevation can reduce swelling, in this case it risks compressing the ulnar nerve at the elbow, especially with postoperative edema, which could result in nerve entrapment and loss of function. The nurse must avoid positioning that places pressure on vulnerable areas and follow specific postoperative protocols for safe recovery. Continuing our NCLEX preparation, let us now explore an important critical care concept with question 15. While reviewing the pathophysiology of septic shock with nursing students, the nurse asks which factor contributes to increased lactate production. The options provided are A. Decreased anaerobic glycolysis, B. Elevated serum bicarbonate levels, C. Improved tissue oxygenation, or D. Inadequate tissue perfusion. The correct answer is option D. Inadequate tissue perfusion. This is because in septic shock, widespread vasodilation and capillary leak impair the effective delivery of oxygen to tissues. When cells are starved of oxygen, they shift from aerobic to anaerobic metabolism, leading to increased anaerobic glycolysis and the accumulation of lactic acid. Elevated lactate is a critical marker that helps nurses identify hypoperfusion and monitor the severity of shock. Nurses should promptly act on elevated lactate levels by improving tissue oxygenation and perfusion through fluids and vasopressors to prevent organ damage. Let us now transition to a mental health prevention strategy with question 16. The nurse organizes a support group specifically for individuals diagnosed with major depressive disorder. The question is, how should this nursing intervention be classified within the levels of prevention? The options are A. Tertiary prevention, B. Primary prevention, C. Secondary prevention, or D. Essential prevention. The correct answer is option A. Tertiary prevention. This is because tertiary prevention focuses on helping clients manage long-term or chronic conditions, reduce complications, and enhance their quality of life. A support group offers these individuals a space to share experiences, strengthen coping skills, and reduce isolation, all of which are key goals in managing chronic mental illness. Nurses play a crucial role in delivering such supportive interventions to promote recovery and prevent further disability. Moving forward, let us look at question 17, which covers the legal and ethical aspect of emergency care. A client arrives at the emergency department after being struck by a car and is found unconscious. The physician determines the need for immediate emergency surgery. The nurse must decide the most appropriate action regarding informed consent. The options include A. Obtain a court order before proceeding with surgery, B. Search the client's belongings for identification or a healthcare directive, C. Immediately transport the client to the operating room for surgery, or D. Contact the police to identify the client and locate next of kin. The correct answer is option C. Immediately transport the client to the operating room for surgery. In emergencies where the client is incapacitated and no surrogate decision-maker is available, the principle of implied consent applies. This means that the care team can proceed with life-saving interventions under the assumption that a reasonable person would consent to such treatment. The nurse should prioritize immediate care, while documentation and family notification can follow. Next, let us consider question 18, focusing on pediatric vision screening. The school nurse performs a corneal light reflex test on a child suspected of having strabismus. The nurse needs to recognize which finding would support this suspicion. The options are A. Symmetrical pinpoint light reflection on each pupil, B. Red reflex observed equally in both eyes, C. Asymmetrical pinpoint light reflection on the pupils, or D. Sunsetting of the eyes. The correct answer is option C. asymmetrical pinpoint light reflection on the pupils. In strabismus, or misalignment of the eyes, the corneal light reflex will appear uneven between the two eyes, indicating that one eye is not properly aligned. This important screening tool helps identify children who need referral to an eye specialist to prevent complications like amblyopia or lazy eye. Let us move on to question 19, which addresses emergency care and mandatory reporting. A child arrives at the emergency department with chemical burns on both lower extremities, and the nurse suspects possible abuse. The nurse must choose the initial action. The options are A. Cover the burns with sterile dressings. B. Irrigate the affected areas with saline. C. Report the suspected abuse to Child Protective Services. Or D. Document the physical findings and injury pattern. The correct answer is option B. Irrigate the affected areas with saline. In any emergency, the priority is to stabilize the client and prevent further harm. For chemical burns, this means immediately irrigating the area to remove the harmful substance and limit tissue damage. After stabilizing the child, the nurse should proceed with reporting and documentation to fulfill legal and ethical obligations. Finally, let us examine question 20, which highlights prenatal health promotion. During a prenatal education class, the nurse discusses ways to reduce the risk of congenital anomalies in newborns. The question is, which vitamin should the nurse emphasize to prevent neural tube defects during pregnancy? The options are A. Folic acid, B. Vitamin B12, C. Vitamin E, or D. Iron. The correct answer is option A. Folic acid. Folic acid is vital for neural tube development, and supplementation before conception and during early pregnancy significantly lowers the risk of defects like spina bifida and anencephaly. This is why it is recommended that all women of childbearing age take at least 400 micrograms of folic acid daily, even before pregnancy is confirmed. If this video is helping you understand NCLEX concepts better, just imagine what our complete Stankos NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX-style practice questions, detailed mock exams, ebook, one-year ACES, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today. Link is in description, and take the stress out of NCLEX prep. Let us continue sharpening our clinical judgment as we move to question 21. The nurse is reviewing a group of assigned clients and must decide which condition requires immediate follow-up. The options are A. A client with a chest tube who has redness at the insertion site. B. A client with ulcerative colitis who reports 3 bloody stools within 1 hour. C. A client with a concussion reporting a headache rated 4 out of 10. Or D. A client with an ischemic stroke and a blood pressure reading of 100 over 58 millimeters of mercury. The correct answer is option D. A client with an ischemic stroke and a blood pressure reading of 100 over 58 millimeters of mercury. In ischemic stroke, maintaining adequate blood pressure is crucial to ensure cerebral perfusion. A lower blood pressure like this compromises oxygen delivery to the brain's penumbra and puts the client at greater risk of worsening neurological injury. Immediate intervention is necessary to support cerebral perfusion and prevent further damage. Now, turning to question 22, we look at electrolyte knowledge essential for safe intravenous therapy. The nurse reviews electrolyte functions and asks which pairing is correct. The options are A. Sodium maintains and regulates circulating blood volume. B. Bicarbonate controls extracellular fluid levels. C. Chloride regulates plasma protein levels. Or D. Calcium is involved in macronutrient metabolism. The correct answer is option A. Sodium maintains and regulates circulating blood volume. Sodium is the primary extracellular cation that controls fluid balance, osmotic pressure, and blood pressure. Its role in drawing water into the vascular space helps sustain tissue perfusion and cardiac output. Let us now move forward to question 23, where spinal cord injury assessment is in focus. A client has sustained a complete spinal cord injury at the level of L3. The nurse must assess for loss of motor function in which area. The options are A. Abdomen, B. Arms, C. Legs, or D. Chest. The correct answer is option C. Legs. Injuries at the lumbar level affect the lower extremities, resulting in motor and sensory deficits in the legs. The arms and chest, innervated by cervical and thoracic nerves, remain unaffected. Next, we come to question 24, which highlights prenatal testing. A pregnant client who is Rh negative is ordered an indirect Coombs test. The nurse considers the purpose of this test. The options include A. To detect maternal antibodies from previous exposure to Rh-positive blood, B. To measure fetal blood clotting time, C. To identify the newborn's Rh factor and antibody titer, or D. To assess the fetus's risk of developing pernicious anemia. The correct answer is option A. To detect maternal antibodies from previous exposure to Rh-positive blood. This test screens for sensitization that could put future pregnancies at risk for hemolytic disease of the newborn, emphasizing the importance of early detection and administration of Rh immune globulin if needed. Advancing to question 25, we focus on infection risk in immunocompromised clients. A client with acute lymphoblastic leukemia presents with a temperature of 101.6 degrees Fahrenheit. The nurse must choose the priority action. The options are A. Review hemoglobin and hematocrit, B. Provide a tepid sponge bath, C. Initiate a peripheral vascular access device, or D. Assess for bruising. The correct answer is option C. Initiate a peripheral vascular access device. Fever in this client signals a possible life-threatening infection, and immediate vascular access allows for blood cultures and prompt administration of broad-spectrum antibiotics, a crucial life-saving measure. Let us move into maternal child care with question 26. A client who is HIV positive is in labor. The nurse must ensure the appropriate medication is prescribed to reduce vertical transmission. The options are A. Valacyclovir, B. Zidovudine, C. Amphotericin, B. or D. Metronidazole. The correct answer is option B. Zidovudine. Administering zidovudine during labor significantly lowers the risk of mother-to-child HIV transmission, forming a cornerstone of perinatal HIV prevention. Continuing to question 27, the focus is on safe post-operative care. A child has just returned from the operating room after a nephrectomy. The nurse must prioritize the first assessment in the post-anesthesia care unit. The options are A. Assess the child's pain level, B. Check the peripheral vascular access device, C. Inspect the surgical incision site, or D. Obtain and evaluate vital signs. The correct answer is option D. Obtain and evaluate vital signs. This allows the nurse to quickly detect early signs of respiratory compromise, bleeding, or shock, critical priorities in immediate postoperative care. And now on to question 28. The charge nurse is assigning tasks to an RN and an LPN. The nurse must determine which task is most appropriate for the LPN. The options are A. Educating a client on low potassium food choices, B. Managing a client leaving against medical advice, C. Calling in prescriptions to the pharmacy, or D. Administering intravenous push breakthrough pain medication. The correct answer is option C. Calling in prescriptions to the pharmacy. This task fits within the LPN's scope as it does not require independent nursing judgment or teaching. Let us now focus on a crucial aspect of postoperative care with question 29. The nurse is caring for a child who has just returned from the operating room after undergoing a nephrectomy. The key question is, which assessment should the nurse prioritize first in the post-anesthesia care unit? The options are A. Assess the child's pain level, B. Check the status of the peripheral vascular access device, C. Inspect the surgical incision site, or D. Obtain and evaluate the child's vital signs. The correct answer is option D. Obtain and evaluate the child's vital signs. In the immediate postoperative period, the nurse's top priority is to assess physiological stability through a full set of vital signs, monitoring the respiratory rate, oxygen saturation, heart rate, blood pressure, and temperature helps detect early signs of complications such as respiratory depression, hypothermia, shock, or internal bleeding. This systematic approach ensures that the nurse can act swiftly at the first sign of deterioration. While pain assessment, incision checks, and intravenous access monitoring are important, they follow the primary ABC-focused assessment to ensure the child's overall stability. Transitioning now to delegation and scope of practice, let us consider question 30. The charge nurse is assigning client care responsibilities to both a registered nurse and a licensed practical or vocational nurse. The question is, which task is most appropriate to delegate to the LPN or VN? The options include A. Educating a client on selecting low-potassium food options. B. Managing a client requesting to leave the hospital against medical advice. C. Calling in a client's prescriptions to the local pharmacy. Or D. Administering intravenous push breakthrough pain medication. The correct answer is option C, calling in a client's prescriptions to the local pharmacy. This task is within the LPN's scope as it does not require independent clinical judgment or teaching. The LPN can legally communicate prescription details to a pharmacy under the direction of a registered nurse or healthcare provider. On the other hand, client education, managing AMA discharges, and administering intravenous push medications are responsibilities requiring the advanced assessment and critical thinking skills of a registered nurse. If this video is helping you understand NCLEX concepts better, just imagine what our complete Stankos NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX style practice questions, detailed mock exams, ebook, 1-year ACES, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today. Link is in description and take the stress out of NCLEX prep. Let us keep building our clinical judgment as we move to question 31, which focuses on fall prevention strategies. The nurse is participating in a quality improvement committee to help reduce fall risks in hospitalized older adults. The question is, which recommendation would be the most appropriate? The options are A. Increase the use of bedside commodes for high-risk clients. B. Request an occupational therapist assess the client's mobility and fall risk. C. Reduce environmental lighting, particularly during nighttime hours. Or D. Remove grab bars from client bathrooms to reduce clutter. The correct answer is option A. Increase the use of bedside commodes for high-risk clients. By minimizing the distance older adults need to travel for toileting, especially at night or when urgency strikes, the risk of falls decreases significantly. This is particularly important for clients with mobility challenges or balance concerns. Now let us shift to a critical care topic with question 32. The nurse is attending a staff education program on disseminated intravascular coagulation, or DIC, and considers which client is at highest risk for developing this life-threatening condition. The options are A. A client with iron deficiency anemia receiving iron sucrose infusion. B. A client being treated for gram-negative sepsis with intravenous antibiotics. C. A client with atrial fibrillation taking rivaroxaban to prevent stroke. Or D. A client on long-term aspirin therapy for cardiovascular risk reduction. The correct answer is option B. A client being treated for gram-negative sepsis with intravenous antibiotics. In sepsis, endotoxins from bacteria can trigger widespread clotting, consuming clotting factors and platelets, and leading to both thrombosis and bleeding. Early recognition and intervention in DIC are vital to prevent multi-organ damage. Moving ahead to question 33, the nurse is monitoring a client receiving norepinephrine infusion. The question is, which statement best explains how this drug works? The options are A. It acts centrally to regulate mood and emotion. B. It is an adrenal cortical hormone managing blood pressure and heart rate. C. It is a sympathetic neurotransmitter that stimulates adrenergic receptors in target organs. Or D. It is a posterior pituitary hormone controlling fluid balance and pressure. The correct answer is option C. It is a sympathetic neurotransmitter that stimulates adrenergic receptors in target organs. Norepinephrine causes vasoconstriction by activating alpha-1 adrenergic receptors, which increases blood pressure, making it crucial in the management of shock states like septic shock. Nurses should monitor for extravasation and titrate the infusion carefully to maintain tissue perfusion without causing harm. Next, let us explore question 34, which is focused on airway safety. The nurse considers which piece of equipment must always be available at the bedside for a client with a tracheostomy. The options are A. Humidifier, B. Spare inner cannula, C. Nasal cannula, or D. Tracheostomy brush. The correct answer is option B. Spare inner cannula. Having a spare inner cannula immediately accessible allows the nurse to quickly replace a clogged or dislodged inner tube, preserving the client's airway and preventing respiratory distress. Other essential bedside supplies include an obturator, suction setup, and extra trach ties to secure the airway effectively. Finally, let us turn to question 35, focusing on pain management for osteoarthritis. The nurse considers which medication is most appropriate to relieve joint discomfort in this condition. The options are A. Allopurinol, B. Etanercept, C. Oxaprozine, or D. Methotrexate. The correct answer is option C. Oxaprozine. This non-steroidal anti-inflammatory drug helps reduce joint pain and stiffness associated with osteoarthritis. While effective, NSAIDs like oxaprozine must be used with caution, especially in clients with renal issues, peptic ulcer disease, or cardiovascular risk, due to potential adverse effects including nephrotoxicity and gastrointestinal bleeding. Let us now shift our focus to emotional support in palliative care as we explore question 36. The nurse is speaking with a terminally ill client who says, "Lord, just give me 2 more months so I can go to my grandson's wedding." How should the nurse interpret this behavior? The options are A. Bargaining, B. Depression, C. Anger, or D. Denial. The correct answer is option A. Bargaining. This statement reflects the bargaining stage of grief as described in the Kubler-Ross model. In this phase, clients often attempt to negotiate with a higher power or fate, in hopes of postponing death long enough to achieve a meaningful goal or attend an important life event. Recognizing these stages helps the nurse provide empathetic and supportive care tailored to the client's emotional needs. Now let us move into the realm of evidence-based practice with question 37. The nurse is researching reliable sources of clinical information and asks, which type of resource should be prioritized? The options are A. Systematic review and meta-analysis studies, B. Expert opinions, C. Qualitative studies, or D. Case studies. The correct answer is option A. Systematic review and meta-analysis studies. These sources are considered the gold standard because they synthesize data from multiple studies and apply statistical techniques to draw meaningful conclusions while minimizing bias. This makes them highly reliable for guiding evidence-based clinical decisions. In contrast, expert opinions, qualitative research, and case studies provide valuable insights but are not as robust for setting practice guidelines. Continuing into critical care management, let us examine question 38. The nurse is caring for a client in a hyperglycemic hyperosmolar state, or HHS, and considers which prescription should be anticipated from the primary healthcare provider. The options are A. 0.9% saline infusion, B. Glargine insulin, C. Sodium polystyrene, or D. Sodium bicarbonate. The correct answer is option A. 0.9% saline infusion. The primary concern in HHS is profound dehydration due to osmotic diuresis, so aggressive fluid resuscitation with normal saline is the first and most urgent step in treatment. Only after volume status is stabilized should insulin therapy be initiated to gradually reduce blood glucose levels. Sodium polystyrene and sodium bicarbonate have no role unless specific electrolyte or acid-base abnormalities are identified, and glargine insulin, being long-acting, is not suitable for acute management. Let us now shift our focus to postpartum assessment with question 39. 1 hour after delivering a set of twins via cesarean section, the nurse begins the routine postpartum assessment. The question is, what should the nurse expect to find during the fundal assessment? The options are A. The fundus is hard, midline, and 1 to 2 finger breadths above the umbilicus. B. The fundus need not be assessed because of the cesarean section. C. The fundus is to the right of the umbilicus and soft. Or D. The fundus is hard, midline, and at the level of the umbilicus. The correct answer is option D. The fundus is hard, midline, and at the level of the umbilicus. Within the first 1 to 2 hours postpartum, regardless of whether the delivery was vaginal or cesarean, the uterus typically rises to the level of the umbilicus and should feel firm and midline. This firmness indicates effective uterine contraction, essential for minimizing blood loss and promoting normal involution. Any deviation or softness may signal complications like bladder distension or uterine atony, requiring immediate nursing action. Moving ahead to skin integrity and long-term care, let us explore question 40. In a long-term care facility, the nurse considers which client is at greatest risk for developing a pressure ulcer. The options are A. An incontinent client who had 3 episodes of diarrhea, B. An 80-year-old ambulatory client with diabetes, C, a 79-year-old malnourished client on bed rest, or D, an obese client who occasionally uses a wheelchair? The correct answer is option C, a 79-year-old malnourished client on bed rest. This client combines two major risk factors, immobility and poor nutritional status, both of which significantly increase the likelihood of pressure ulcer formation. Malnutrition impairs tissue repair and integrity, while immobility leads to sustained pressure over bony prominences. Together, these factors create the perfect storm for skin breakdown, making vigilant assessment and prevention strategies crucial. If this video is helping you understand NCLEX concepts better, just imagine what our complete Stancoast NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX-style practice questions, detailed mock exams, ebook, one-year ACES, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today. Link is in description, and take the stress out of NCLEX prep. Finally, let us consider maternal child health again with question 41, which focuses on postpartum complications. A client who is 2 weeks postpartum reports flu-like symptoms, a headache, and localized breast tenderness. Upon assessment, the nurse notes enlarged axillary lymph nodes and erythema of the left breast. The question is, what condition is the client most likely experiencing? The options are A, endometritis, B, mastitis, C, pelvic inflammatory disease, or D, cystitis. The correct answer is option B, mastitis. Mastitis typically occurs between 2 to 4 weeks postpartum and is marked by systemic symptoms such as fever, chills, and malaise, along with localized breast inflammation. The presence of tenderness, erythema, swelling, and lymphadenopathy strongly points to this diagnosis. Early antibiotic treatment and continued breastfeeding or milk expression are essential to manage the infection and support maternal recovery. Let us now turn our attention to question 42, which focuses on medication safety in migraine management. The nurse is assessing a client who is receiving a prescribed dose of sumatriptan for migraine relief and needs to identify which client report should raise immediate concern. The options are A, nervousness, B, warm sensation, C, angina, or D, tingling sensation. The correct answer is option C, angina. Sumatriptan works by causing vasoconstriction of cranial blood vessels to relieve migraine pain, but it can also cause dangerous vasoconstriction of coronary arteries, leading to chest pain, myocardial ischemia, or even infarction. This makes angina a potentially life-threatening adverse effect that demands prompt evaluation for cardiac compromise. While nervousness, warm sensations, and tingling are common side effects that are generally benign, chest pain should never be ignored in clients taking sumatriptan, especially those with underlying cardiovascular risks. Let us move on to an essential emergency nursing topic with question 43. The nurse is preparing to lead a staff training session on the emergency management of anaphylaxis. The key question is, what critical point should the nurse emphasize first? The options are A, 0.9% saline should be infused once vascular access is established. B, the initial treatment is intravenous diphenhydramine. C, the client should carry a pre-filled syringe of hydrocortisone. Or D, if shock occurs, the client should be positioned in reverse Trendelenburg. The correct answer is option A, 0.9% saline should be infused once vascular access is established. In anaphylaxis, rapid fluid shifts and vasodilation cause profound hypotension. Immediate fluid resuscitation with isotonic saline supports circulatory volume while waiting for the life-saving effects of intramuscular epinephrine, the true first-line drug therapy. Nurses must act fast to secure IV access, start fluids, and administer epinephrine to stabilize the client. Now, let us shift to a question on respecting cultural and spiritual values in healthcare with question 44. The nurse is preparing a client for a potential blood transfusion and considers which religious group is known to generally refuse blood products due to spiritual beliefs. The options are A, Catholicism, B, Jehovah's Witnesses, C, Islam, or D, Christian Reformed Church. The correct answer is option B, Jehovah's Witnesses. This group typically declines transfusions of whole blood and major blood components as part of their religious practice. It is essential for nurses to verify each client's specific beliefs, provide education on alternatives if available, and collaborate with the healthcare team and ethics services to respect the client's wishes while ensuring safe care. Let us continue our NCLEX preparation with question 45, which focuses on safe and effective pain management. A nurse has just completed a staff development conference on patient-controlled analgesia, or PCA, and reflects on key points of understanding. The question is, which statement by the nurse indicates correct knowledge of this pain management method? The options are A. A client may be prescribed a loading dose before they are able to activate their own prescribed dosage. B. PCAs are not recommended for individuals with acute pain. C. PCAs decrease the need for a client to have pain assessments. Or D. When a client receives a PCA via a continuous basal rate, it decreases their risk for adverse effects. The correct answer is option A. A client may be prescribed a loading dose before they are able to activate their own prescribed dosage. This loading dose helps bring pain under control quickly, ensuring therapeutic plasma levels of the analgesic before the client begins self-administering doses. It is important to remember that PCA devices still require frequent pain assessments and vigilant monitoring for side effects like respiratory depression, particularly when basal rates are used. Now, let us shift our focus to question 46, covering the classification of pain. The nurse is reviewing types of pain with nursing students and asks, how should pain of sudden onset and short duration be classified? The options are A. Chronic pain, B. Acute pain, C. Referred pain, or D. Neuropathic pain. The correct answer is option B. Acute pain. Acute pain acts as a protective mechanism, alerting the body to injury or illness, and typically resolving once healing occurs. It generally lasts less than 3 to 6 months and responds well to a variety of treatments, both pharmacologic and non-pharmacologic. Unlike chronic pain, it serves a clear biological purpose and is usually proportional to the underlying condition. Finally, let us explore a critical neurological complication in question 47. The nurse is caring for a client diagnosed with a subarachnoid hemorrhage and considers which electrolyte imbalance is most likely to develop as a complication. The options are A. Hyperkalemia, B. Hypocalcemia, C. Hyponatremia, or D. Hypermagnesemia. The correct answer is option C. Hyponatremia. This imbalance commonly arises due to syndrome of inappropriate antidiuretic hormone secretion or cerebral salt-wasting syndrome following a subarachnoid hemorrhage. Hyponatremia often occurs several days after the initial bleed and may coincide with vasospasm, heightening the risk of cerebral ischemia. Close monitoring of serum sodium levels and neurological status is essential to prevent secondary brain injury in these clients. Let us now focus on pediatric emergencies with question 48. The nurse is assessing a child suspected of having epiglottitis and must recognize the most likely finding. The options are A. Absence of spontaneous cough, B. Harsh, productive cough, C. Generalized skin flushing, or D. Coarse tremors. The correct answer is option A. Absence of spontaneous cough. Epiglottitis is a life-threatening condition caused by rapid swelling of the epiglottis, leading to potential airway obstruction. The absence of a spontaneous cough is a key indicator, as severe edema and pain prevent effective coughing. Children often appear anxious, drool, and assume a tripod position to aid breathing. Nurses must avoid throat visualization attempts, as this could trigger complete airway closure, and should ensure emergency airway equipment is ready while notifying the provider immediately. Next, let us turn to question 49, which addresses medication safety in electroconvulsive therapy. The nurse is reviewing medications for a client scheduled to receive ECT and asks which medication should be questioned before the procedure. The options are A. Venlafaxine, B. Esomeprazole, C. Topiramate, or D. Lurazidone. The correct answer is option C. Topiramate. As an anticonvulsant, topiramate raises the seizure threshold, potentially interfering with the controlled seizure required for therapeutic effect in ECT. Coordination with the prescribing provider is essential to determine if it should be held. By contrast, venlafaxine, esomeprazole, and lurazidone are generally safe to continue during ECT and may support symptom management or reduce aspiration risk. Finally, let us consider a situation involving client autonomy and therapeutic communication in question 50. A client refuses their prescribed subcutaneous heparin injection. and the nurse must determine the most appropriate initial response. The options are A. Document the refusal, B. Notify the primary healthcare provider, C. Review the client's most recent platelet count, or D. Inquire with the client about the refusal. The correct answer is option D. Inquire with the client about the refusal. The nurse should always begin by exploring the client's reasoning, as this supports the assessment phase of the nursing process. Open communication allows the nurse to address concerns, provide education, and correct misconceptions before escalating the issue. If the client persists in refusing, the nurse should document the refusal and inform the healthcare provider. If this video is helping you understand NCLEX concepts better, just imagine what our complete Stancoast NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX style practice questions, detailed mock exams, ebook, 1-year ACES, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today. Link is in description, and take the stress out of NCLEX prep. Let us now explore question 51, which highlights medication safety in clients with altered gastrointestinal anatomy. The nurse receives a prescription for an oral bisphosphonate for a client recently diagnosed with osteoporosis and must identify which condition in the client's history would most strongly contraindicate this therapy. The options are A. Diabetes mellitus, B. Hypercalcemia, C. Lactose intolerance, or D. Roux-en-Y gastric bypass. The correct answer is option D. Roux-en-Y gastric bypass. Clients who have undergone this surgery have altered gastrointestinal anatomy that increases the risk for esophageal irritation and ulceration from bisphosphonates. The changes in absorption and the potential for reflux further heighten the danger, making alternative treatments more appropriate. In contrast, diabetes mellitus and hypercalcemia are not contraindications, and lactose intolerance does not interfere with bisphosphonate administration, though it may influence overall calcium intake. Moving on to question 52, we focus on recognizing electrolyte imbalances linked to endocrine conditions. A client arrives at the emergency department with carpopetal spasms, lip and hand tingling, and a prolonged QT interval on electrocardiogram. Laboratory results reveal hypocalcemia, prompting the nurse to consider which condition is most likely. The options are A. Hyperthyroidism, B. Hypothyroidism, C. Hyperparathyroidism, or D. Hypoparathyroidism. The correct answer is option D. Hypoparathyroidism. This condition results in decreased parathyroid hormone secretion, leading to low calcium and high phosphate levels. Signs like tetany, perioral numbness, and carpopetal spasms are classic indicators, along with electrocardiogram changes such as prolonged QT interval. Rapid correction of hypocalcemia is crucial to prevent serious complications, including laryngospasm and dysrhythmias. Finally, let us consider question 53, which centers on appropriate laboratory monitoring. The nurse reviews new prescriptions and scheduled lab tests for 4 clients and must identify which combination should prompt questioning. The options are A. Liver function tests for a client prescribed atorvastatin, B. International normalized ratio for a client prescribed rivaroxaban, C. Serum creatinine level for a client prescribed lisinopril, or D. Glycosylated hemoglobin for a client prescribed olanzapine. The correct answer is option B. International normalized ratio for a client prescribed rivaroxaban. Unlike warfarin, rivaroxaban does not require routine INR monitoring, as this test does not reliably reflect its anticoagulant activity. Monitoring liver function with statins, kidney function with ACE inhibitors, and glycemic control with antipsychotics like olanzapine are all appropriate and evidence-based practices. Let us now focus on professional responsibility and mandatory reporting with question 54. A 12-year-old boy visits the school nurse for a nosebleed, and during the assessment, the nurse notices multiple bruises in various stages of healing on the child's back and forearms. When questioned, the child gives vague and inconsistent answers, leading the nurse to report suspected abuse to Child Protective Services. The next day, the boy's mother angrily confronts the nurse in her office. The question is, what is the most appropriate response by the nurse? The options are A. I am required by law to report any suspected violence. B. You should have thought about this before you abused your son. C. I'm so sorry. Please do not take this out on me. Or D. Do not talk to me about this. I do not want to see you. The correct answer is option A. I am required by law to report any suspected violence. This response is calm, factual, and professional, reinforcing the nurse's legal duty without making accusations or escalating the situation. Nurses are mandatory reporters, obligated to report suspicions of abuse or neglect to protect vulnerable individuals, even in the absence of definitive proof. The nurse must maintain composure, avoid emotional or judgmental statements, and focus on fulfilling ethical and legal responsibilities. Let us now turn our attention to question 55, which highlights the critical priorities of post-operative nursing care. The nurse is planning immediate care for a client in the recovery unit and must identify the first priority in the initial assessment. The options are A. Respiratory status, B. Tolerance to bimouth fluids, C. Pain level, or D. Ability to move the extremities. The correct answer is option A. Respiratory status. In the immediate post-operative period, the nurse's top concern is airway and breathing, as residual sedation from anesthesia can impair gas exchange and compromise airway patency. Complications like hypoventilation or aspiration can escalate rapidly, making it vital to assess respiratory rate, depth, oxygen saturation, and overall airway integrity before addressing other needs such as pain or fluid tolerance. Next, let us move on to safe delegation in question 56. A registered nurse and a licensed practical or vocational nurse are jointly managing the care of a violent client who removed their intravenous line and required physical restraints. The question is, which responsibility may the RN appropriately delegate to the LPN or VN? The options are A. Collect data on the client's skin integrity, B. Educate the client on the need for restraints, C. Initiate peripheral vascular access, or D. Continually assess the client to determine if restraint use is necessary. The correct answer is option A. Collect data on the client's skin integrity. The LPN or VN can collect objective data such as checking for skin breakdown, monitoring circulation under restraints, and documenting findings. However, tasks involving clinical judgment, such as evaluating the necessity of restraints or providing initial client education, must remain the RN's responsibility to ensure safe, ethical, and legal care. Finally, let us consider question 57, which focuses on mentoring and correction of unsafe practices. A nurse preceptor is observing a newly hired nurse care for multiple clients and identifies an action that requires immediate follow-up. The options are A. Humidifying nasal cannula oxygen for a client with sarcoidosis, B. Securing a suprapubic catheter to the client's inner thigh, C. Placing a client with varicella zoster in airborne and contact isolation, or D. Suctioning a tracheostomy for 10 seconds while removing the catheter. The correct answer is option B. Securing a suprapubic catheter to the client's inner thigh. This action is incorrect because a suprapubic catheter exits through the lower abdomen and should be secured to the abdomen to avoid tension on the insertion site. Improper securing increases the risk of dislodgement and skin injury, making immediate correction and teaching essential to prevent complications. Let us now move on to question 58, which focuses on interpreting arterial blood gas results, a vital skill for safe and accurate nursing care. The nurse is reviewing a client's ABG values, pH 7.50, PaCO2 28 millimeters of mercury, and bicarbonate 25 milliequivalents per liter. The nurse must determine how to interpret these findings. The options are A. Metabolic alkalosis, B. Respiratory acidosis, C. Respiratory alkalosis, or D. Metabolic acidosis. The correct answer is option C. Respiratory alkalosis. The pH is elevated above 7.45, indicating alkalosis. The carbon dioxide level is below the normal range of 35 to 45 millimeters of mercury, signaling that excessive respiratory exhalation, commonly due to hyperventilation, is the cause. Because the bicarbonate level is normal, this points to a respiratory origin rather than metabolic. Common triggers for respiratory alkalosis include anxiety, pain, fever, or early sepsis, and management centers on addressing the underlying cause and promoting controlled breathing to restore carbon dioxide balance. Let us continue with question 59, which focuses on pain management in acute pancreatitis. A nurse is admitting a client newly diagnosed with acute pancreatitis and considers which medication to anticipate. The options are A. 3% saline infusion, B. Fentanyl, C. Diphenoxylate atropine, or D. Sucralfate. The correct answer is option B. Fentanyl. Acute pancreatitis presents with severe epigastric pain that often radiates to the back, accompanied by nausea, vomiting, and abdominal distension. Pain control is a top priority, and fentanyl, a potent opioid, is commonly prescribed due to its rapid onset and tolerability. In contrast, hypertonic saline is not part of standard fluid resuscitation. Normal saline or lactated ringers are preferred. Antidiarrheals like diphenoxylate atropine are contraindicated because they can promote paralytic ileus, and sucralfate is not indicated as pancreatitis does not involve direct mucosal injury. Moving forward to question 60, we focus on discharge planning and community referrals. The nurse is preparing to discharge 4 clients and must identify who most urgently needs referral to outpatient community support services. The options are A. A client newly diagnosed with skin cancer who lives with family, B. A client recovering from a stroke being transferred to inpatient rehabilitation, C. A client who is homeless and has a substance use disorder, or D. A client leaving against medical advice for treatment of cellulitis. The correct answer is option C. A client who is homeless and has a substance use disorder. This client faces dual challenges of unstable housing and a behavioral health condition, placing them at high risk for treatment disruption and poor health outcomes. Immediate referral to community resources for housing, addiction support, and case management is critical. The other clients, while needing follow-up, have either a support system or a plan for continued care that reduces immediate risk. If this video is helping you understand NCLEX concepts better, just imagine what our complete StanCoast NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX-style practice questions, detailed mock exams, ebook, 1-year access, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today. Link is in description, and take the stress out of NCLEX prep. The nurse is assessing a client currently pregnant at 25 weeks who reports a prior twin birth at 31 weeks, a stillbirth at 23 weeks, and a spontaneous abortion at 12 weeks. The question asks for the correct GTPAL documentation. The options are A. G4-T0-P2-A1-L2, B. G4-T0-P1-A2-L2, C. G4-T0-P1-A2-L3, or D. G4-T1-P1-A1-L2. The correct answer is option A, G4-T0-P2-A1-L2. This reflects 4 pregnancies total, 0 term births, 2 preterm deliveries, the twins and the stillbirth, 1 abortion under 20 weeks, and 2 living children represented by the twins. Stillbirths after 20 weeks are counted under preterm or term births, not abortions, and multiples count as 1 delivery in GTPAL but are tallied individually under living children if alive. Now, let us move on to question 62, where we focus on safe medication practices related to metoprolol. After attending teaching about metoprolol, a client makes several statements, and we need to identify which one indicates correct understanding of this medication. The options are A. I should stop taking metoprolol immediately if I feel dizzy or lightheaded. B. Metoprolol helps lower blood pressure by increasing angiotensin II production. C. I need to monitor my heart rate because this drug can slow it down too much. And D. It is important to take metoprolol with a high-fat meal to make it work better. The correct answer is option C. I need to monitor my heart rate because this drug can slow it down too much. Metoprolol is a beta-1 selective blocker that reduces heart rate and myocardial contractility, making it effective for hypertension, heart failure, and angina. Because bradycardia is a common side effect, clients should regularly check their pulse and report values below 60 beats per minute, or symptoms such as dizziness or fatigue. Abruptly stopping metoprolol, as mentioned in option A, can cause rebound tachycardia or hypertension. Option B is incorrect because metoprolol works through beta blockade, not by increasing angiotensin II. And option D is not accurate, as food does not significantly impact metoprolol's absorption. Let us now transition to question 63, which challenges our ability to prioritize care. The nurse has been informed of 4 client situations during handoff. Which client should the nurse assess first? The options are A. A client in a private room with a stage 3 pressure ulcer testing positive for Pseudomonas aeruginosa. B. A client 3 hours post-operative from an ileostomy with a red edematous stoma. C. A client with type 2 diabetes, a blood glucose level of 76 milligrams per deciliter, and refusing breakfast. Or D. A client awaiting an appendectomy who reports worsening abdominal pain with coughing, relieved by bending the right hip. The correct answer is option D. A client awaiting an appendectomy who reports worsening abdominal pain with coughing, relieved by bending the right hip. This presentation strongly suggests peritoneal irritation and possible appendiceal rupture, which can lead to life-threatening peritonitis. This client requires immediate evaluation and preparation for emergency surgery. While the other clients need care, their conditions do not pose the same immediate risk of rapid deterioration. Continuing with question 64, we turn to infection control measures. The nurse is planning care for a client diagnosed with Mycoplasma pneumonia. What is the most appropriate infection control measure? The options are A. Place the client in a private room with negative airflow. B. Wear a surgical mask when within 3 feet of the client. C. Wear gloves when in contact with the client. Or D. Provide disposable meal trays and utensils. The correct answer is option B. Wear a surgical mask when within 3 feet of the client. Mycoplasma pneumonia is transmitted via respiratory droplets, so droplet precautions are required. This includes wearing a surgical mask within close proximity to the client. Negative airflow rooms, gloves for all contact, or special meal trays are unnecessary for this form of pneumonia. Let us move ahead to question 65, focusing on medication monitoring. The nurse is reviewing laboratory data for a client prescribed lithium therapy. Which finding requires immediate follow-up? The options are A. White blood cell count of 11,500 per cubic millimeter. B. Fasting blood glucose of 112 milligrams per deciliter. C. Serum creatinine level of 1.6 milligrams per deciliter. Or D. Free thyroxine level of 0.6 nanograms per deciliter. The correct answer is option C. Serum creatinine level of 1.6 milligrams per deciliter. This elevated creatinine suggests impaired renal function, which increases the risk of lithium toxicity. Prompt provider notification is necessary. The other findings either reflect expected effects or are less urgent. Transitioning to question 66, the nurse receives a prescription to administer thiamine. The question asks, thiamine is most likely prescribed to treat which condition? The options are A. Systemic lupus erythematosus, B. Pernicious anemia, C. Wernicke's encephalopathy, or D. Iron deficiency anemia. The correct answer is option C. Wernicke's encephalopathy. Thiamine deficiency and alcohol use disorder or malnutrition can lead to this condition, marked by confusion, ataxia, and ocular abnormalities. Thiamine is essential to prevent irreversible neurologic damage. Logically, let us explore question 67, which addresses obstetric complications. A pregnant client at 32 weeks reports sudden, painless, bright red vaginal bleeding. The uterus is soft, non-tender, and fetal heart tones are normal. What complication should the nurse suspect? The options are A. Placenta previa, B. Threatened abortion, C. Placental abruption, or D. Uterine souffle. The correct answer is option A. Placenta previa. This condition involves abnormal placental placement over or near the cervical os and presents with painless bleeding in the 3rd trimester. Unlike abruption, it is not associated with pain or uterine rigidity. Now, let us consider a different type of leadership. Question 68. A nurse manager rarely provides guidance, allowing staff to set their own priorities and manage their work independently. The manager intervenes only when problems arise. Which leadership style does this represent? Here are options. A. Laissez-faire, B. Transformational, C. Democratic, D. Transactional. The correct answer is A, because laissez-faire leaders adopt a hands-off approach, offering little direction or involvement. Clinical insight. Laissez-faire leadership may work well with highly experienced, self-motivated teams, but can lead to poor coordination and outcomes if overused. Moving on to another leadership style. Question 69. A nurse leader closely monitors staff performance, provides clear expectations, and uses rewards or corrective feedback based on whether goals are met. Which leadership style is being demonstrated? See the options. A. Transformational. B. Transactional. C. Democratic. D. Laissez-faire. Correct answer is B. Transactional. See the rationale. The correct answer is B because transactional leadership focuses on structure, performance, rewards, and discipline to achieve goals. Clinical insight. Transactional leadership can promote accountability and task completion, but may limit innovation if overused. Let us now turn our attention to a key assessment technique for evaluating arterial blood flow. The Allen test. Question 70. The nurse is preparing to obtain an arterial blood gas sample from the radial artery. Which of the following actions by the nurse best describes how to perform the Allen test to ensure collateral circulation? Here are options. A. The nurse palpates the radial artery while asking the client to make a fist repeatedly for 30 seconds. B. The nurse simultaneously compresses the radial and ulnar arteries. Asks the client to clench and unclench the fist, then releases pressure from the ulnar artery to observe for color return. C. The nurse compresses the brachial artery and observes for hand blanching. D. The nurse applies a blood pressure cuff, inflates it above systolic pressure, and assesses for loss of radial pulse. The correct answer is B because the Allen test assesses the adequacy of ulnar artery collateral circulation before radial artery puncture or cannulation. If color returns to the hand within about 5 to 15 seconds after releasing the ulnar artery, collateral blood flow is considered sufficient. Clinical insight. Always perform the Allen test before obtaining an arterial blood gas sample from the radial artery to prevent complications like hand ischemia if radial blood flow is compromised. If this video is helping you understand NCLEX concepts better, just imagine what our complete Stand Coast NCLEX review course can do for you. With over 100 hours of fully animated crash course lectures, 5,000 real NCLEX-style practice questions, detailed mock exams, ebook, 1-year access, and one-on-one personal mentoring, we give you a clear, proven path to success. Whether you are preparing for your first attempt or trying again, this is your shortcut to passing with confidence. Do not miss out. Enroll today. Link is in description and take the stress out of NCLEX prep. Let us wrap this session with an important clinical sign that helps identify gallbladder inflammation. Murphy's sign. Question 71. The nurse is assessing a client who presents with right upper quadrant abdominal pain, fever, and nausea. To check for Murphy's sign, which technique should the nurse use, and what indicates a positive finding? Consider the options. A. The nurse palpates the right lower quadrant and looks for rebound tenderness. A positive sign is sharp pain upon release. B. The nurse palpates deeply at McBurney's point. A positive sign is increased pain on palpation. C. The nurse places fingers under the right costal margin, asks the client to take a deep breath, and notes if the client abruptly stops inhaling due to pain. D. The nurse percusses over the flank. A positive sign is pain that radiates anteriorly. The correct answer, C. Because Murphy's sign is used to assess for cholecystitis, inflammation of the gallbladder. A positive Murphy's sign occurs when the inflamed gallbladder contacts the examiner's fingers during inspiration, causing pain that halts the breath. Clinical insight. A positive Murphy's sign is a classic finding in acute cholecystitis and helps distinguish it from other causes of abdominal pain. Thanks for watching. We will see you in next